Hello, my name is Reverend Prince Rivers. I'm here with a public service announcement from the North Carolina Department of Health and Human Services. We know that COVID-19 pandemic has changed all of our lives. I'm a dad, I'm a family man, I have a mother in her 80s. I'm very concerned that we know how to take care of each other. And there's some things that we can do to take care of ourselves and the people we love. We can practice good health measures, like washing our hands frequently, like maintaining social distance, 6 feet apart, 2 arms length from other people, wearing face coverings in public. All of these things will go a long way to help us slow the spread of this dangerous and contagious pandemic. COVID-19 is affecting the African American and Latinx communities especially hard. It's not because we have underlying genetic predispositions, but rather it's because of the pre-existing health concerns that were already prevalent in our communities: diabetes, asthma, COPD, and hypertension. We have to do a good job of taking care of ourselves and the people we love. Social distancing can be difficult. We like to get together for family reunions, for church services, and other kinds of social gathering. You don't have to be disconnected from family and friends, but we are asking you to maintain physical distance. So make sure you stay in touch by reaching out by phone, by email, and other virtual ways where you can make sure that you and your loved ones are safe and sound. We also know that in the African American community, wearing face coverings in public may lead to police bias. If you or someone you know has an experience of perceived police bias, please make sure that you contact local law enforcement in that area. We will make it through this. We have to rely on faith, but also wisdom as well. And so make sure that you're taking care of yourself, but also listen to medical professionals, listen to the public health experts. They're giving us good advice on how to make sure we can slow the spread of this pandemic.
Greetings, fellow North Carolinians. Thank you all for joining us this morning. My name is Quinn West Godwin. I serve as the Central Regional Field Coordinator for the 75th Governor of North Carolina, Governor Roy Cooper, in his Office of Public Engagement. Governor Cooper, along with cabinet secretaries, agency staff, and thousands of state employees, have been working nonstop to fight this pandemic and help the people of North Carolina get through this tumultuous time. This is OPE's 12th webcast since March. Our purpose is to have multidimensional information sharing to make sure we are available, transparent, equitable, and connecting with all North Carolina communities during this crisis. Yesterday, Governor Roy Cooper and North Carolina Department of Health and Human Services Secretary Dr. Mandy Cohen announced that North Carolina will remain in Safer at Home Phase 2 for 3 more weeks. Governor Cooper also announced that face coverings must be worn when people are in public places as officials seek to stabilize concerning trends of increasing viral spread. Today's program will focus on these updates and more. Just like our previous sessions, we encourage you to engage with us via the YouTube stream chat or the WebEx stream, where you can send questions in real time. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary for Health and Human Services at the North Carolina Department of Health and Human Services, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, and Mr. Jeremy Collins, Director of the Office of Public Engagement, will provide Division of Employment Security updates and address added concerns submitted today and close our session. Again, thank you all for being with us this morning. We also encourage you to visit the North Carolina Department of Health and Human Services website at ncdhhs.gov/coronavirus, where you can find other resources and information. With that being said, I invite Deputy Secretary Benjamin Money to the stage. Thank you.
Thank you, Quinn, and good morning. As we stated from the beginning of this pandemic, science and the facts are guiding our response to COVID-19. Our testing, our tracing, and our trends are key to this work. And the 3 W's are key to our safety and protection. That's wearing a face covering, waiting 6 feet at a minimum, and washing our hands. So I'm here to tell you that our trends are not where we want them to be. As of yesterday, in North Carolina, COVID-19 cases were 1,721. And we had 906 people in the hospital. This is the second highest day in both these categories since the pandemic started. Unfortunately, we've also had 1,271 people who've passed away as a result of COVID-19. Since May 19th, the number of people that are hospitalized has increased 56%, from being in the 500s to now just over 900. This is just in a little over a month. So, as you know, North Carolina has been careful in our lifting of COVID-19 restrictions. And it's because removing restrictions too fast or all at once can cause a dangerous spike in the virus that would overwhelm our medical system. That's something that we've been concerned about. That's our efforts around flattening the curve. Not only would that harm people with COVID-19, but also those needing treatment for other conditions. So our daily case counts have gone up. The percent of tests returning positive has also stayed high. Right now, they're around 8 to 10%. And since May 19th, those numbers continue to trouble us. So our cautious approach is very much like a dimmer switch rather than an off and on switch. And over the past weeks and months, as we've slowly turned up this dimmer switch and eased our restrictions, we've also seen community spread of the virus increase in North Carolina. Our testing and our tracing efforts have increased, and this actually helps us see where spread is occurring and take appropriate action. So doctors and healthcare experts have warned that our hospital capacity can get quickly overwhelmed. And once we see that capacity is gone, it may be too late to reverse the tide. In fact, Dr. Anthony Fauci, who's the director of the National Institutes of Allergy and Infectious Diseases, testified before Congress on Tuesday that North Carolina could see, quote, an insidious increase in community spread, which would be more difficult to contain as community spread amplifies itself. In other words, as it perpetuates, it gets harder and harder to control. He cautioned us to act to blunt the surge of cases, and that the next couple of weeks is going to be critical for not only North Carolina, but our country in our fight against COVID-19. So we're seeing national trends, but yesterday, states that have gone down in the Northeast that saw some of the first spikes, including Connecticut, New York, and New Jersey, announced that travelers from other states where community transmission remains high, and that includes North Carolina, will need to quarantine for 14 days after their arrival. So yesterday, Governor Cooper announced that North Carolina will pause and continue our Safer at Home Phase 2 for another 3 weeks. Again, this is not where we hope to be. This isn't where we wanted to be. But it is one of 2 important decisions that we needed to make to effectively fight this disease. The other important decision is requiring face coverings when people are out in public. Over the past few months, we've learned a lot about COVID-19 transmission. And we know now that people who are infected but do not have symptoms can infect others by spreading respiratory droplets through activities like speaking, like coughing, laughing, and singing. Growing scientific evidence actually suggests that the consistent use of face coverings by the public during a pandemic can help reduce the spread of COVID-19, especially from people who have it and don't yet know that they have the disease. Cloth face coverings can reduce the release of infectious particles into the air when someone speaks, when they cough, when they sneeze. Cloth face coverings are not a substitute for staying 6 feet apart, or washing your hands, or staying home when you're ill. A cloth face covering is a material that covers the mouth and the nose, and it can be secured to the head with ties or straps, or simply wrapped around the lower face. It can be made of a variety of materials, such as cloth, silk, or linen. A cloth face covering may be factory-made or sewn by hand, or it can be improvised from household items such as scarves, t-shirts, sweatshirts, or towels. You're seeing more and more face coverings available in retail establishments, and others, employers as well as insurers, are beginning to distribute those. But don't wait until you get one from someone else. Go ahead and get yours now. Ideally, a face covering is going to have 2 or more layers, and these face coverings are used not for healthcare providers, but for the general public. So healthcare providers utilize surgical masks or procedure masks or N95 respirators, and we're not recommending those for the general public because we need to make sure that we're retaining those for our healthcare providers. So when you use a face covering, be sure to place the covering over your nose and your mouth and keep it in place at all times while you wear it. You'd be surprised at the number of people that I've seen that have a face covering and it's not properly covering both their nose and their mouth. Also, people must wear face coverings when in public places, indoor, outdoor, where physical distancing of 6 feet at a minimum from people is not provided. You don't have that opportunity. Or if you're not with members of your household or residence. So these settings include, but they're not limited to, being inside or in line to enter any indoor public space, including public schools, waiting for or riding on public and private multi-person transportation, including but not limited to buses, taxis, ride sharing, private care services, vans, and other modes of public transportation. Engaging in work, whether in the workplace or performing work off-site, when you are or may be within 6 feet of other people, including working in or working through common areas such as lobbies, hallways, stairways, elevators, and parking facilities. So also, if you're obtaining services in a healthcare setting, if you're outdoors in public spaces when maintaining a physical distance of 6 feet from persons or members of the same household or residence is not feasible, and this restriction does not apply to persons while inside their residence or the personal residence of another person. And also, face coverings may be removed to participate in religious ritual. So we also know that certain businesses are required to have patrons and employees wear face coverings, whether they are inside or outside, when they are or may be within 6 feet of another person, or unless there's an exception that applies. Specific occupational settings are including healthcare settings, should continue to follow existing protocols and require surgical or procedural masks or N95 respirators. Again, those are for healthcare settings. So the following businesses need to abide by Executive Order 147 and utilize face coverings. These are, again, our retail businesses, restaurants, personal care, grooming, tattoo businesses, child care facilities, day camps, overnight camps, gyms, exercise facilities, fitness facilities, state government agencies, transportation, high-density occupational settings where social distancing is difficult, including manufacturing settings, construction sites, migrant farm and other farm settings, meat or poultry processing plants, long-term care facilities, and other healthcare settings. Now, we do have some exceptions. Face coverings do not need to be worn by an individual worker, customer, or patron who has, one, a medical or behavioral condition or disability and cannot wear a face covering. This is including, but not limited to, any person who has trouble breathing or is unconscious, incapacitated, or otherwise unable to put on or remove the face covering without assistance. Some people may have trouble breathing or sensitivity to having something placed over their face. If you or someone you support is unable to wear a face covering, be sure to take other steps to avoid unnecessary exposure. And some additional exceptions. So there's an exception for children under 11 years of age. There's an exception if you're actively eating or drinking, if you're engaging in strenuous exercise or swimming, if you can't maintain safely maintain at least 6 feet distance from others. You do not need to wear a face covering when exercising outdoors, but if you can't maintain that 6 feet distance, you really should consider it or consider an alternate location. Also, if you're communicating with someone who is hearing impaired in a way that requires the mouth to be visible, that's an exception. Now, we do know that deaf and hard of hearing people often use lip reading to help understand what those around them are saying. And when people are wearing face cloth coverings, other communication strategies are needed. So some of the things you can do are try finding a face cloth covering that has a clear plastic area that allows the lips to be visible. Writing notes back and forth between the person, writing on a whiteboard to communicate, or even utilizing a free speech or texting app on a mobile device, as well as gesturing if communication is necessary. But assure that you're stepping back additional feet and removing the face covering just long enough to communicate with the person. So if you're giving a speech, as I am right now, for a broadcast or audience, it's okay to remove your face covering. Also, if you're working from home or alone in a vehicle, if you're temporarily removing your face covering to secure government or medical services for identification purposes is required, then removing it. If it would be a risk, wearing a face covering at work, and that would be determined by state or federal regulators or workplace safety guidelines. Also, if a face covering is impeding visibility to operate equipment or a vehicle. And also, if a child whose parent or guardian is responsible has been unable to place a face covering safely on that child's face, that can be another exception. Cloth face coverings obviously shouldn't be used on babies or children under the age of 2 because of the danger of suffocation. And children over the age of 2 should wear face cloth coverings that they can reliably wear, remove, and handle cloth face coverings throughout the day. One of the things that we know, and Quinn mentioned this, well, actually the video mentioned it earlier, is that there are some people that are may experience anxiety and fear of bias because of being profiled wearing face coverings in public spaces. But wearing cloth face coverings protects your family, your friends, and your neighbors. If you are the target of ethnic or racial intimidation as a result of adhering to face covering guidelines, or as a result of this pandemic, you are strongly encouraged to report the matter to law enforcement or other government entities. Everyone should be able to wear cloth face coverings without fear of profiling or violence or bias, and any type of public racial racial intimidation, profiling, or bias for wearing a face covering should not be tolerated. So when you get this cloth face covering, be sure to take good care of it. Wash your face covering frequently, ideally after every use, or at least daily. Have a bag or bin to keep cloth face coverings in until they can be laundered with detergent and hot water and dried on a hot cycle. If you must re-wear your cloth face covering before washing, wash your hands immediately after putting it back on and avoid touching your face. So discard your cloth face coverings that no longer cover your nose and your mouth, or if the elastic is stretched out or damaged, if it can't stay on your face, obviously, and also if it has holes or tears in the fabric. Face coverings, again, are a simple way to control this virus while we protect ourselves, our families, and other people around us. It's important for us to recognize that there's zero harm to us or to our economy from wearing face coverings. In fact, it makes it safer for us to shop, for us to do business, and to keep our small businesses running. As we watch the trends during this pause, we hope to be able to ease restrictions on playgrounds, museums, and gyms on July 17th. That will be 3 weeks from Friday when this order expires. We know that this virus has been difficult for business owners, but still, under safety restrictions, they're anxious to open up their doors, and we want them to do that safely. So please, please do your part to help North Carolina curb the spread of COVID-19. Practice the 3 W's. Wear a face covering, wait at least 6 feet apart, and wash your hands frequently. I'd like to invite at this time Carolyn Farmer to join us at the stage to talk about volunteer opportunities to help in our efforts around COVID-19. And again, thank you so much for your commitment and your active engagement in addressing this pandemic.
Thank you, Ben. Good morning. My name is Caroline Farmer. I'm the Executive Director of the Commission on Volunteerism and Community Service. Phase 2 extended. I can honestly say I am not happy about it, that it's not unexpected, but I wish that we had moved forward with lower numbers and could move on to phase 3. But I've learned to embrace the mask. I got a new mask, celebrating Independence Day. And it's becoming sort of a fashion accessory. You see people wearing them all the time. Mine was made by a local college student who doesn't have a job, just recently graduated and started sewing masks. So I'm trying to help out. For the attitude that I've seen, as Ben had mentioned, there's been some negative attitudes about the mask. And I just want to address that for a second, because it kind of reminds me of what I remember about the seatbelt law. If y'all remember, people thought it was ridiculous that the government was requiring people to wear seatbelts. But then they learned that it saved lives. They learned to just automatically put on the seatbelt when they get in the car. The mask is that next thing. The mask not only saves your life, but it saves those people around you. This seems like a small price to pay to help your neighbors, to help your community. And what does that mean for us for helping our community other than wearing a mask? Is I want you to think about the volunteer opportunities that exist right now. If you can sew, there are communities out there that do not have masks. Specifically, in Ashe County, there's a need for the Hispanic population to have masks. Swain County, the community has been crying out for masks. Now, in addition to that, food. Food will always be on this list. We need help with pantries. We need help with food delivery. If you go to volunteernc.org, you will see the opportunities listed under the Volunteer Opportunity tab. I encourage folks to go to that website and look at the recent opportunities. We also send out immediate emails if you want to sign up so that you know what volunteer opportunities exist or are coming up. Specifically for the food, just in this week, Buncombe County Meals on Wheels needs more volunteers. Ahoskie, the food pantry, needs more volunteers. This is two different places across the state. This is a regular occurrence we are hearing, is the need for volunteers. Now, if you're a nonprofit, you're a community group, what does this phase 2 extended mean for you? It means now you are responsible to make sure that the volunteers, your staff, are wearing their mask. It's not just a choice anymore. The volunteers need to be wearing their masks. Because no matter what, you know if you set them apart 6 feet, they're going to end up moving. They're going to walk around. They're going to pass each other in the halls. So you're going to follow the same regulations that retail merchants follow. So it is your job as the entity to make sure that your volunteers and your staff are wearing those masks. I want you to encourage everybody to contact us if you have questions, if you need volunteers, if there's a group around the state that is in need of something. volunteernc.gov is our email account. You're welcome to contact us or email at the governor, OPE. We'll send you that contact information. But I want to make sure that until you hear from us again, that you know how to reach us, that you know how to get information. And I hope as Independence Day is coming up that everyone who's listening make sure that you have a very, very safe Independence Day, socially distanced with masks. So on behalf of the governor, thank you all very much for your time.
Hello, I'm Dr. Viviana Martinez Bianchi, a family doctor and educator. Latinx and African American populations are experiencing disproportionately higher risk for COVID-19 morbidity and mortality, not because of a genetic predisposition, but because many of the health conditions that place a person at high risk for serious illness from COVID are the conditions that disproportionately impact Latinx and African Americans, social determinants and structural factors contributing to poor health outcomes. As a physician who is concerned about the patients I serve and my community's health, there are 3 things that I need you to do, especially if you have a chronic medical condition. They are the 3 W's. Wash your hands with soap and water for at least 20 seconds. When out in public, wait to make sure you're at least 6 feet or 2 arms lengths away from another person, avoiding close contact. And wear a protective face covering when out in public or larger crowds. COVID-19 is preventable, and by following these 3 precautions, everyone can reduce their risk of contracting and spreading this highly contagious virus. Remember, we're all in this together, and it is up to each one of us to take care of ourselves, our families, and communities. For more facts and information about COVID-19, visit www.ncdhhs.gov/COVID-19, or if you need help, call 211 or 888-892-1162.
Good afternoon. My name is Jeremy Collins. On behalf of the 75th Governor of the State of North Carolina, Governor Roy Cooper, thank you for being with us this afternoon, this morning, rather. I first want to thank all of our participants at this point, Quinn Godwin, Brother Ben Money, Sister Caroline Farmer, and for our PSA participants today. This program is focused on Phase 2 extended. As Caroline said a moment ago, here we are. We're not necessarily excited about the reasons that we're here, but we do feel responsible enough, the governor feels responsible enough to listen to the science, listen to the data. The data says that we're not ready to move to Phase 3, and the governor is taking action to keep us safer. I'm applauding him. Communities across the state are applauding him. And even in that applause are offering ideas about how we can move forward even safer. And so, again, as we say every week, please feel free to reach out to us at governor.nc.gov if you have ideas about kind of what we can be doing and ways to be helpful. We've got a number of reports across the state where gyms are open despite the executive order, and places that are not supposed to be operating in a certain fashion are operating in defiance of the executive orders. And what we tell folks is contact your local law enforcement. Those entities are there to enforce executive orders, and if the local law enforcement has said that they refuse to enforce the executive orders, please let us know. Please notify our office of that, and we can circle back with them to try to get those agencies to comply and to enforce compliance with the executive order. The governor is not excited about these decisions. Our Department of Public Safety is not excited to keep gyms closed, but we're looking at spaces where the virus can most easily spread. And we want to be able to go to gyms. We want to be able to be in close proximity with each other. But at this point, our physical distance is absolutely critical in keeping this virus at bay. I'll give you a brief update from our Department of Employment Security. To date, both federal and state payments have toppled $4 billion, $4,542 million. We do have a dashboard up now at our department, our Division of Employment Security, that you can visit if you type in unemployment benefits data in North Carolina Department, our Division of Employment Security. You can see a dashboard with a daily update of how much has been paid out, claims that have been made, and data on how to access every level of employment, whether it be state unemployment insurance, pandemic emergency unemployment compensation, pandemic unemployment assistance, and federal pandemic unemployment compensation. Again, all those totaling over $4 billion. At this point in North Carolina, we have over 1,089,000 claimants, for which about 222,000 people are ineligible for benefits. That's somewhere around 20%. 222,000 persons are ineligible for benefits. What that says to us is that there's still a lot of people hurting who we don't have a direct form of remedy for them. But that's where so much of what Caroline is talking about with our volunteer organizations and our community action organizations and our faith-based groups, our Divine Nine organizations, that's that chasm between what government can do and what people need. We really need to step in and try to fill that void. And so there are tremendous amounts of resources going out, but then there's still, a large population, almost a quarter of our population of folks who are still, well, not a quarter, but a large number of our population who are still hurting without recourse. And so we need to make sure that we are still reaching out to help people, still being that bridge in our respective communities. And if you're looking for service, again, reach out to us and let us know. Hearing a lot across the state about the need for increased broadband access. The governor and the Cabinet and Department of Information Technology, Secretary Tracy Dokes, are working very hard to make sure that the Band-Aid of hotspots are being deployed in different places, but also to get the necessary mapping done to expand broadband into the necessary communities. So that is happening. We're hearing a lot across the state as far as a resurgence of kind of racism and oppression and vitriolic words and actions in response to demonstrations around police brutality and white supremacy. We want to know about that. Let us know where we can be helpful, where we can be supportive. The governor has been very clear in his executive orders and his actions, and so much farther than his words, that white supremacy and racism, racial disparities are things that will not be tolerated, and that we're going to keep moving to root out these things that create divisions among us and build in spaces and promote in spaces that create unity and this garment, this garment that we're tied in, this single garment of destiny. And so where you're seeing those things, where you're hearing that activity, please report them to local law enforcement. And if you are unsuccessful at that level, make sure that you are reporting it to your local elected officials, and by all means, let our office know how we can be helpful. A few things that have come up on the call that I want to make sure that we address really quickly. One, retail shops are still able to be open. I got a message earlier from the western part of the state. Can retail shops that participate, that are a part of museums, can they be open? Yes. If you're a retail shop, you can be open, so long as you abide by the guidelines, meaning the 3 W's: to wait 6 feet, wash your hands, and wear a face covering. That is a good segue into this very simple thing that is being made political about wearing a face covering. It is the least we can do to wear a face covering. It is not just for the safety of our neighbors and our loved ones, it's an act of love. We're a country, a group of people who say that we support those who would give the ultimate sacrifice, and we support our troops, and we support all these folks that are willing to give so much for who we are. It is then antithetical to that for us to raise and protest this idea that we cannot or should not be wearing a face covering. Simply put something on your face to make sure that just in case you have the mask, you're not spreading it to someone else. We're not going to feel guilty about asking you to do that. It's something that's absolutely necessary, and an unwillingness to do that really speaks to something else. It's not that's a simple ask, and it's something that's absolutely necessary. So we hope that you will do that, and if you can't get a mask, we hope that we can get you one. The last thing I'll address is that's come up is with the face covering requirement that's a part of Phase 2 extended. What does that mean for persons who have or hold concealed carry permits? I've spoken with our general counsel, and I want to make certain that everyone knows that by North Carolina law, you may wear a face covering and concealed carry with a permit. There is no provision in state law that says that because you have a face covering, you cannot use or access or enjoy the privilege of concealed carry permit. And so where you're hearing that, just make sure that you know that that is in fact untrue. You can conceal carry and wear a face covering. Folks, we're going to be in this for another 3 weeks. And I've got really good advice for everyone who has consternation around this. You want to move out of Phase 2, wash your hands, put on a mask, wait 6 feet, and tell all your friends to do the same. We're not holding us here for fun. This is not a hoax. We're gonna want our kids to go back to school in a couple of months, and you can't go to the beach and hang out and lick each other in the face and want everybody to go back to school. Them two things can't live together. And so I want you to be very mindful of that. We want to move into Phase 3, but we're going to listen to the science, and we're going to be guided by what is best for all North Carolinians. And so with that, I want to thank everybody for being with us. We'll be back before you again in 2 weeks, hopefully in preparation to move into Phase 3. We'll be listening and looking at the science. I want to thank Secretary Mandy Cohen, Governor Cooper, Secretary Hooks, Secretary Michelle Sanders, Secretary Regan, all the cabinet secretaries that are working together to keep us safe as we move forward. We look forward to being back in front of you in 2 weeks to give you some more updates. And in the meantime, in the interim, if you have questions, again, if it's related to COVID-19, nc.gov/COVID-19. If it's related to things that we can be doing, as the website suggests, governor.nc.gov. And if you'd like to give us or make a request specifically to us, whether it be about PPE or ideas that you have about the best ways that we can move forward, please send us a message directly at ope@nc.gov. That email address again is ope@nc.gov. Thank you very much for being with us, and we look forward to a healthier North Carolina in 2 weeks and an opportunity to give you some exciting news as we move forward. Thank y'all.